Bismillahirrahmanirrahim. I'm Dr. Ahmad Wahid Khan, PGR, MPH, Community Medicine Department, King Edward Medical University. My supervisor is Professor Dr. Saira Afzal. Today, the topic of my presentation is COVID-19 Workplace Guideline. Learning outlines, introduction, mode of transmission, variants of COVID-19, symptoms of COVID-19, diagnosis, COVID-19 at workplace, key principles of health and safety, COVID-19 hazard risk and risk assessment, hierarchy of control, recent updates, and MCQs. Introduction. It is a single strand positive sense RNA. It is a enveloped virus, large size virus particle. Incubation period is about 5 days. Zoonotic virus and pandemic. Coronavirus structure. Medium size virus but largest mRNA genome. Enveloped positive stranded RNA encased in nucleocapsid. Lipid bilayer soap work to disrupt this. Crowns for spikes. Glycoprotein spikes. Peptometer spikes allowed it to attach to human cell receptors in upper and lower airway. Mode of transmission. Mode of transmission is person to person between people who are in close contact with one and other within 6 feet through respiratory droplets produced when an infected person cough or sneeze, spread from contaminated object or surface. It may be possible that person can get COVID-19 by touching surface that has virus and then touching their own mouth, nose or ear. COVID-19, what are mutations? Like all viruses, SARS-CoV-2 has been mutating since it emerged in late 2019. Mutation changes in genetic code in virus spike protein can infect its ability to infect cell. These are some variants of concern of COVID, which are alpha, beta, gamma, and delta. The timeline of variants of coronavirus. First one is alpha, second one is beta variant, third is gamma variant, fourth is delta, and fifth latest is omicron. Symptoms of coronavirus include cough, shortness of breath, difficulty breathing, fever, chills, muscle and body aches, vomiting, diarrhea, loss of taste or smell. What is the difference between upper RTI and COVID-19? Upper RTI symptoms are similar to COVID-19, including fever, pain, cough, sore throat, running nose, muscle pain, and headache. However, COVID-19 might show lower respiratory tract symptoms such as chest tightness, pain when coughing, wheezing when walking and talking. The body temperature rises, the body feels cold. Some patients may lose their sense of taste and smell, while others may have rashes. The survey conducted by King's College London in UK found that 17% of confirmed patients had rash as the first sign of COVID-19 and 21% said that inflammation is their only symptom. Are there any sequel to upper RTI influenza, less sequel cold, no sequel COVID-19 permanent damage such as pulmonary fibrosis? COVID-19 patient may have respiratory failure even after they have recovered because their lungs are damaged, or some may suffer permanent lung damage. Other patients may experience liver damage, some of whom may experience liver failure. Diagnosis. Laboratory test. First one is serological test, ELISA, indirect fluorescent antibody test, but serological test for COVID-19 is underdeveloped. Second one is molecular testing, more effective nucleic acid amplification test, which is commonly called PCR test. Specimen is through respiratory sputum, throat swab, and nose swab. This is a chart showing how to protect yourself and around the people through corona by wearing a mask, get vaccination. If you have symptom, even mild ones, stay home and take test if you can. Socialize outdoors or safely in small group of indoor. Wash your hand. Use alcohol-based hand sanitizer. Cover when sniffing or coughing. Clean and disinfect frequently. Eat well and stay active. Get enough sleep and stay connected to friends and family. Safety at work, health, regulation, compliance, PPEs, hazard analysis and control training and education. Key principles of health and safety. Employer is responsible for maintaining a safe and healthy workplace. Employees should be involved in developing policies and programs. Employer should implement best and most effective practices policies to protect workers from hazard. COVID-19 hazard risk and risk assessment. A COVID-19 secure workplace must have a risk assessment carried out and consider hazard and risk. A risk assessment, a systematic method of looking at work activities, considering what could go wrong. This include thinking about who can be harmed and how badly they could be affected, and deciding on suitable control measures. These control measures are designed to eliminate, reduce, or minimize the risk of loss, damage, or injury in the workplace. A hazard is something that can cause harm. A risk is the chance, high or low, that any hazard will actually cause somebody harm. Areas to assess risk, premises where are they, how large are they, what is the capacity, toilets and welfare facilities and communal areas, lifts, stairs and access points, practices, what is business and how is it conducted, do you deal with the public or any other external groups alongside your own staff. People who are they vulnerable or particularly at risk or have access need. How do they get to their place of work? Principle of risk assessment. First, identify the hazard, decide who can be harmed and who cannot, evaluate the risk and decide on control measures, record the finding and implement them, review and update. Identify the risk. How are people exposed to COVID-19? COVID-19 as a hazard is transmitted people to other either by direct contact or with infected by contact with contaminated object and surfaces. These microscopic virus droplet can transmit it when people breathe, speak, sneeze, and cough. You are at great risk when you are within 2 meters of an infected person. They can also be transmitted by someone touching a surface that the droplets have rested on and then going on to touch their face, eyes, nose, mouth. In heavily contaminated area, there may also be risk of inhaling these droplets from the air when they are disturbed. The more people and places you come into contact with, the more likely you are to be exposed to the virus. COVID-19, what are most likelihood source of infection in the workplace, entrance area, door, toilets, washing facilities, lifts, stair, bedrooms, personal living spaces, wards, classrooms, office space, kitchen, and other food preparation areas, meeting rooms, restaurant, eating, drinking areas, and other communal areas, halls, pathways, Driving cabs, crowded outdoor areas such as parks, garden, play area, and courtyard. COVID-19 hazards in workplace created by task, environment, and people. Work tasks. Are you facing each other? How many colleagues do you come into contact with? Do you come into contact with members of public service user if you are not normally working from there's still some tasks you can do at home. Working environment, desk space and layout is there sufficient distance? How many people are there in your area and in the building? Individual staff, reasonable adjustment, personal circumstances, pre-existing health condition or risk factor. Decide who might be harmed. Any risk must assess how and who may be at most of harm. Those most are at risk of harms from COVID-19 are those classed as at high risk, extremely vulnerable, those classed at moderate risk, older workers, those with poorer health, ethnic origin. Significant data suggests that black people are disproportionately affected by COVID-19. Regional variation, there is increasing evidence of significant regional differences in the rate of infection. Evaluate the risk and decide on the control measure. Having identified the hazard, employer must then decide how likely it is that harm will occur. For example, the level of risk and what to do about it. Where possible, they must eliminate the risk. If that is not possible, employers must do everything that is reasonably possible to minimize it. It is not possible to completely eliminate the risk of you catching COVID-19, but it is possible to eliminate the risk of infection in your employer's workplace by working from home. Where working from home is not possible, employers can reduce the risk. Some example of action employers can take are applying strict hygiene and social distancing, reducing the number of people you can come into contact with, organizing the workplace so that you are facing away from colleagues, erecting barriers such as perspex screening between you and service user, organizing your task workload so that you can work from home wherever it is possible. Here is the risk assessment matrix. An employer should use this or a similar matrix to assess how serious a risk the spread of COVID-19 is. They do this by multiplying the consequence by likelihood. In this case, any score above 8, the risk is high, and above 16, it is extreme. Hierarchy of control, they said use what is called a hierarchy of control is used to rank how effective controls can be and or the order in which they should be used. Although it is often called a hierarchy, they must consider all measures and how they effective they are all when applied together. Any control measure, including PP, should be funded by the organization. This is a chart of hierarchy. This is a hierarchy of control. First, we have elimination, then substitution, then engineering control, administrative control, and PPs. More effective is elimination. What is a COVID secure? This is a phrase means make their work operation as safe as possible for employees when they return to work. However, the five key point to implementing COVID secure workplacing working practice are work from home, carry out COVID-19 risk assessment in consultation with workers and trade unions, maintain 2 meter social distancing wherever possible, where people cannot be 2 meter apart, manage transmission risk, reinforcing cleaning process. COVID-19 hierarchy of control elimination, completely eliminating exposure to the hazard, the most effective control. Substitution, replacing the hazard with a non-hazardous object, device, or a substance. Engineering control, isolating the person from the hazard through physical and mechanical means. Administrative control, change made to the way that people work. And then PP commonly is equipped to want to minimize exposure to a variety of hazard. Example of PP include such as gloves, foot and eye protection, protective hearing devices, earplugs, hard head respirator, and full body suit. Community protective equipment, equipment worn by person to prevent community spread from a asymptomatic carrier of COVID-19. Controls method. Elimination, stay home, work remotely and avoid public areas, work on campus and avoid occupied public areas, avoid use of shared equipment and spaces, virtual appointment, meeting, site visit, training through the use of web conferencing applications, Zoom, Skype, or video calls. Substitute personal contact by, for example, providing information online or by phone, using technology such as Skype to conduct meetings. Engineering control include get vaccinated with an FDA-approved COVID-19 vaccine, use of biosafety cabinet when performing research, handles, push button, and other high-touch point made of copper coated with copper tape. SARS-CoV-2 has a low virus stability on copper surface, and research has proven there to be no viable virus after 4 hours on copper surface. Administrative controls include social distancing requirements. Maintain a 6 feet distance from other. If you are unable to maintain distance, you shall wear a mask. Use floor markings and other barrier type of for more distancing. Cough and sneezing procedure. Use your sleeve is a good way to cover your sneeze or cough with smaller risk of contamination. Proper hand hygiene and control procedures. Do not touch eyes, nose, mouth, face. Wash hands thoroughly with soap and water for 20 to 30 seconds. In the absence of soap and water, use alcohol-based hand sanitizer. Hand sanitizer is not a replacement for good hygiene. Wash your hand as soon as possible. Disinfection procedures for specific operation facilities and or work areas. Employee health monitoring, formalize the stay home if you sick and have had contact with a person known to test positive for COVID. Stay home if you have any symptoms of illness. If you are at work and you develop symptom of an illness, distance yourself from other, contact your supervisor. Go home and remain home until symptom free. Employee health protection procedure, employee training, return to work health and safety training for COVID-19, restart checklist to enable consistency in our restart effort, modified interaction or screening procedure with customer, public, student, or employer with the intent to minimize exposure to any of these groups. Shift change procedure, have people coming in half time or stagger the work, or look at existing high density area and ask half of staff for work on site certain days with virtual meetings, work days and or two, so only one out of two workspaces is occupied on any day or a portion of day. Stagger start time to avoid bottleneck at the entrance. PPE, COVID-19 related PPE requirement currently exists for patient care, person under investigation, transport, isolation room entry, and COVID-19 research. Respirator protection program requirement apply to all employee who wish to done to respiratory. N95 respirators and KN95 respirators are critical supplies that must be reserved for healthcare workers, first responder, and those performing high-risk tasks in direct support of the continuity of healthcare, public safety, or essential research. Always follow PPE donning and doofing. Order of operation. Always follow facial hair guidance to ensure proper seal of mask. Consult to manufacturers. PPE is a requirement for disinfectant products prior to use. A community protective equipment, face covering, and mask are to be worn as a community effort to prevent asymptomatic carriers of COVID-19 from spread the virus. Wearing such face covering shall not be used in order to in of other control method, and user must be vigilant about clean hand with soaps and water. Wearing N95 respirator, discard or wash cloth face covering after each use. Do not wear a cloth face covering when it is damp or wet. When removing the cloth face covering, remove it from behind. Do not touch the front. Recent updates: COVID-19 prevention and control measures in workplace setting, a rapid review and a meta-analysis. A workplace can be a high risk environment for SARS-CoV-2 outbreak and subsequent community transmission. Identify, understanding, and implementing effective workplace SARS-CoV-2 prevention and control measure is critical to protect workers, their families, and communities. A rapid review and meta-analysis were conducted to synthesize evidence assessing the effectiveness of COVID-19 IPC measure implemented in global workplace setting through April 2021. Medline, Embase, PubMed, and Cochrane Library were searched for studies that quantitatively assess the effectiveness of workplace COVID-19 IPC measure. These studies included comprised varying empirical design and occupational setting. Measure of interest included surveillance measure, outbreak investigation, environmental adjustment, personal protective equipment change in work arrangement, and worker education. 61 study from healthcare, nursing, home, meat packing manufacturers, and office setting were included, accounting for 280,000 employee based in Europe, Asia, and North America. Meta-analysis shows that combined IPC measure resulted in lower employee COVID-19 positivity rate than single measures such as asymptomatic PCR testing, 1.7%, 95%, and CI is 0.9 to 2.9%. Modeling study shows that combination of timely and widespread contact tracing and case isolation, facilitating smaller worker cohort, and the effective use of PPE can reduce workplace transmission. Comprehensive COVID-19 IPC measure incorporating swift tracing and case isolation, PPE and facility zoning can effectively prevent workplace outbreak. Masking alone should not be considered sufficient protection from SARS-CoV-2 outbreak in the workplace. MCQs. 1. 32-year male presented in the OPD with complaint of headache, cough, difficulty in breathing, and the recent loss of smell taste for the last 3 days. And the patient also told that about his recent history of travel 2 weeks back. On the chest X-ray examination, there is a presence of pulmonary fibrosis. The most likely cause of is option A is adenovirus, option B is coronavirus, option C is parainfluenza virus, option D is respiratory essential virus, and option E is rhinovirus. Correct answer is B, coronavirus. Question number two. The word WHO recognized SARS-CoV-2 as a public health concern and declared it as a pandemic on March 11, 2020. Which of the following mode of transmission showed no evidence that people can catch COVID-19 infection through this route? Option A, close contact with contaminated object. Option B, consumption of cooked food. Option C, respiratory droplet generated during coughing. Option D, respiratory droplet generated during sneezing. Option E is respiratory droplet generated during sneezing, during talking. Uh, Option B is the right answer. Question number three, the technical advisory group on SARS-CoV-2 virus evaluation in the ABC country assesses that specific mutation and combination of mutation alter the behavior of COVID-19 virus. The epidemiological situation showed three distinct peak in reported case in ABC country despite preventive measure vaccination. This variant is known as option A multiple variant association, option B is rare variant association, option C is single variant association, option D variant of concern, option E is variant of interest. Mhm. Option D is the right answer. Question number 4, a SARS-CoV-2 variant with genetic changes is suspected to affect virus characteristics, indicating that it may pose a future risk. The earliest documented sample distribution of VOC of the recent Omicron variant is from option A South Africa May 2020, option B UK September 2020, option C India October 2020, option D Brazil November 2020, option E is multiple countries. Option E is the right answer. Question number 5, a 35 years male presented in the emergency with coughing, difficulty in breathing, and fever for the last 3 days. The patient also gave a history of contact with the COVID-19 positive patient. Which of the following tests a healthcare provider should recommended diagnosing the COVID-19? Option A cell culture, option B direct fluorescent antibody test, option C ELISA, option D is indirect fluorescent antibody test, option E is PCR. E is the right answer. Question number 6, a coronavirus disease 2019 caused by severe acute respiratory distress syndrome coronavirus 2 was initially reported in December 2019 as a pneumonia with unknown etiology in Wuhan city of China. According to WHO, which of the following variant of COVID-19 is highly diverse variant with greater mutation and risk at the global level? Option A alpha variant, option B beta variant, option C delta variant, option D gamma variant, and option is Omicron. E is the right answer. Question number 7, a 38-year male employer employed in the ABC organization was exposed to COVID-19 and became COVID-19 positive. The most effective way to control a COVID-19 hazard is to option A administrative control, option B elimination, option C engineering control, option D is PPE, option E is substitution. B is the right answer. Question number 8, the last line of defense in the hierarchy of control to deploy effective control within an organization, workplace, or community to control a hazard is? Option A is administrative control, option B elimination, option C engineering control, option D PPE, and option E substitution. D is the right answer. Question number 9, an ABC organization had a recent outbreak of COVID-19 infection in their employees. Achieve a method of assessment. Option A, diagnostic assessment. Option B, evaluative assessment. Option C, formative assessment. Option D, risk assessment. And option E is summative assessment. D is the right answer. Question number 10, the XYZ organization assessed the risk of COVID-19 spread by using a risk assessment matrix method. Approximately half of the employees have a risk assessment matrix score above 16, which showed the risk of COVID-19 infection is option A is extreme, option B is high, option C is low, option D is moderate, and option E is nil. Option A is the correct answer. This is the key of all these MCQs. These are the references to which this presentation have been made. Here is the YouTube link of this presentation. Thank you.